Hi, hello. Hi from Pet Partners. Hi from Bellevue, Washington. I'm hoping that you guys are out there. Thank you to everyone who has made the commitment to spend some time together here today. Would love to know who's here. Would love for you to start typing in. Let me know. Say hello. Looking for the comments. I should have some comments, I think, coming up here soon. And want to know who's there. There we go. Hello from Nevada. Hello, Alexandra. First in. Early bird gets the worm. Would love to know who's here. Tell me who's here. Let me know if you're a pet partner team. And of course, if you are, who your buddy is, who your therapy animal partner is. Liz, my pleasure. Liz says, thanks for doing this. My pleasure. Delighted to be here with all of you. Yeah, let me know who's here, who your partner is. Let me know if you're a prospective handler, thinking about it. Hi to Boston Children's Hospital and all the kids there. Just welcome, welcome, welcome. Thanks for being here. Who else? Let's see. If you're with a facility where our teams normally visit, love to hear that. If you're here because you're a practitioner or a professional and you practice animal-assisted interventions in your practice, let me know. We'd love to hear from you too. Oh, we've got Paula from Argentina. We've got a great program in Argentina. Thanks for being here and for making the time. So just welcome, welcome, welcome. It's so fun to see all of you guys here. And oh, Tiger from New London, Connecticut. Yes, and Duke's her buddy. And Frisco's here. Oh, it's so great. This is fun. I can actually just sit here all day and see all these. Hello, Gypsy, the mini horse is here. Hello, Gypsy. I could sit here and read these all day, but that's probably not why you came, is it? So keep them coming, though. We want to know who's here. I've got some back-end help who's going to be along for the ride today. So shout out to our team member, Julia Heath, who's going to be, as we talk, she's going to be putting some links in the comments and all for you so that you can easily navigate to some of the resources that we're going to talk about. So I'm, as promised or as promoted, I'm Annie Peters, President and CEO of Pet Partners, and really proud to be associated with this great organization and with all of you. So thanks again. So we're going to talk a little bit today about Pet Partners' response to COVID. What we've done to date and why, and then want to talk about sort of just kind of what's on the horizon and what's happening and what's coming down the pike that you can look forward to as well. So, gosh, starting with COVID-19, what a challenging time this has been for all of us. I'm certain when I say that, I can probably say we are all having that kind of a challenge. When I think about it, we all think about how we ourselves are trying to figure out how to navigate this difficult time. I think about how when all this started in almost two phases. You know, to me, there was sort of this like acute phase starting in March. Depends like when this got on your radar and when you started to pay attention. Certainly, you probably all will remember that there was a lot of attention on a nursing home here in Kirkland, Washington, which is just the next town just north of where I live. And a lot of friends and all were, you know, texting and emailing in from around the country. Hey, like, what's going on out there? And like, I don't know. I kind of know what you know. I know what I see on the news. And then from there, things just seem to deteriorate really kind of rapidly. And so I think of it a little bit as, for me, how I've framed it. And maybe it's because of how we've approached things at Pet Partners. But I sort of think about this acute time from maybe mid-March until the end of April. I think, you know, we first were asked to stay at home and it seemed like maybe it was going to be for 2 weeks. And then there was chatter it was going to be longer and maybe June. And it was such a confusing time and such a horribly stressful time, right, for so many people trying to figure out just what's going on during that time. And then for me, at least, once we sort of got through the end of April and we got through the end of April and on into May, and some of the stay-at-home orders were lifting a little bit. I sort of feel like we entered into this more of this chronic phase, this kind of lasting phase about how we were trying to now learn to live with it. And we could argue, you know, maybe in some places back to sort of this acute, really intense time where maybe as a country, we're not doing as well as we'd like to do in terms of learning how to live with the virus for now. But when I think about pet partners and our thought process and our communications and everything that's happened, I kind of think about that in those two chunks, that sort of acute phase from mid-March up until the end of April, and then from May on. So during those first 6 weeks, let's call it, like all of you, we were struggling to try to understand and to figure out, just what was going on and what was happening. And how was that going to affect the therapy animal program? And how was that going to affect, of course, visiting? And then everything else that we do that comes along with visiting that helps prepare all of you and allows you to work with your teams and, the evaluation that we do, the education, and just everything that goes into making a successful and safe and impactful therapy animal team. So we did focus a lot on the evaluation process, because for those of you who are pet partner teams, you know the importance of the reevaluation, how much value we place on that. And many of you were due for because we were new in quarters, many of you were due for your renewal, right, for your evaluation renewal. And that just wasn't going to be able to take place during the stay-at-home orders. So we went through a lot of modeling and talking about it and thinking about it and how do we handle this. And there was this sort of initial quick reaction of, we're going to extend your registration by 3 months and 6 months for some of you, thinking that maybe this problem, this virus, this issue would go away by then, and we could just catch up and get back to our evaluations and kind of get back to things more as usual. Then it started to become a little bit more apparent that wasn't going to really be the case. So that's when we made the decision to extend everyone's registration from 2 years to the 3-year time frame. And given ourselves a longer horizon and runway for all of you who are due for renewal in the 12-month period from April 1st, 2020 through March 30th of 2021. But then also recognizing that if we delayed those renewals for 1 year and pushed them forward and pushed them out a year, then we were going to be doubling up on the number of evaluations that had to happen from, say, March of 2020 to April 2021 to March of 2022. And a big shout out, first of all, to all of our evaluators. I see some of you that are weighing in, and some, I don't know if you guys are seeing it, some really weird spamming going on. Hopefully I'm just seeing that and you're not. But for those of you who are our evaluators, let me know who our evaluators are and who are here. A huge shout out and a huge thank you to all of our evaluators, because without you, there would be no therapy animal program. So we could not very well, coming out of this, ask all of our evaluators who work so hard now to do double duty and to start, with in April of 2021, doing double the number of evaluations. So then that's why we made the decision on the people who were not due for an evaluation until 13 to 24 months out, a reevaluation, to also add another year onto their evaluation. So what was a 2-year pet partner registration is now a 3-year registration, just as we all get through this pandemic and through this challenging time. So we do know in a few, hey, there's an evaluator in Wisconsin. Thank you, Christine. Shirley here, an evaluator in Chicago. Hey, Shirley. And an evaluator instructor, Ann Rosenwasser. Thank you. Thank you. Without you, we would not have a program. So big thank you and shout out to our evaluators. So there's been a few evaluations that have taken places in some places around the country with masks, with social distancing as much as possible. Lots of challenges, certainly to get through that, but it is definitely working in the sense that with the extension of the registration, most of you don't have to reevaluate anytime soon. So one other comment about that is we've done a lot of work at Pet Partners over the years thinking about, you hear about companies and all talk about their brand promise and what do we stand for. And the thing that we stand for at Pet Partners that we believe, or our sort of go-to mantra, is we care. So we care about, how much we care about the animals who do this amazing work. We care about our facilities. We care about risk mitigation and reducing disease transmission. We care about the clients and the population that you all serve as therapy animal handlers. And when we were looking at how to handle and how to respond to the pandemic in those early 6 weeks, we care about you as volunteers. And the absolute last thing that we wanted to do was to add any stress to anything that anybody was going through, in the idea that they needed to have an evaluation. So that very much entered into our thinking about those plans. So that was sort of our, managing of the therapy animal program reaction to COVID right out of the gate. I will share with you we have a major concern going forward. And our biggest concern is the importance of new teams to the therapy animal program and how much your communities are going to need more teams, not less, when we can return to visiting and life gets back to something more like what we know it to be. I see Sue's here, Sue Grunfest is here from Las Vegas, and I think about the incredible work that her and her fellow team members at Pet Partners of Las Vegas did after the aftermath of that horrible mass shooting at the country music concert there on the Strip. And they were very, very busy serving their community in the immediate aftermath after the shooting, and even a year later, marking a year from the time that horrible tragedy happened. And we all know, and we all read, and we can all see that there are mental health repercussions around what we're going through. A lot of what I've been reading is that there are many people who have never struggled with mental health issues who now are experiencing anxiety and depression for maybe the first time in their lives and trying to navigate that. From what I read from the experts, there are many people who will, when this is over, be able to sort of put that chapter behind them and move on and go back to sort of enjoying how they've approached life in a way that's more recognizable to them. But that there's going to be many, many of us who are going to have some lasting issues as a result of all of this. So when we think about the important work that you do serving your community, and we navigate this time and you get back to visiting, we really, really recognize that we're going to need more teams. And that's the challenge that we're having with people not reevaluating right now with extending the registrations. That's all good. But the inability to hold the number of evaluations that we would normally have and welcoming new teams into the program is a major concern for us if this goes on for a year and it's impacted and we're limited in such a significant way. So we've communicated that with many of you, and we've communicated that with our community partners and our community groups, and really have asked for your help and your assistance in terms of trying to keep the program front and center and letting people know that if they do have an interest, they have an animal that's right for therapy animal work, that they can get started now. So many of you have jumped on board and you're offering virtual volunteering with your pet sessions, and we appreciate that. Directing, although many of you as instructors offer the handler course in person in your community, a limited ability to do that now, so directing people to the online handler course. So for those of you who are a prospective handler, you're new to Pet Partners, your opportunity to become a registered therapy animal team starts with educating you on the human end of the leash. And that's either our online handler course or an in-person course by one of our licensed instructors. So we already had, going back and looking at the numbers, about 77, so almost more than 3/4 of our prospective handlers came in through the online handler course, but we still had about 25% who preferred that in-person learning opportunity. So for right now, many of you are directing people to the online handler course, and those instructors you're using your time to get people started in the program with a volunteering with your pet virtual session, a shorter session before people make the commitment. But it's never too early to get started in terms of wanting to be a therapy animal handler and getting started on that education. And if you do take the online handler course, that knowledge that you've gained and that showing that you've taken the course, it's good for 2 years. So it takes many people 6 to 9 months anyway to get through the entire program. So it's never too late to start the process to become a registered handler. So for those of you who are interested in doing that and are here today, visit the website, petpartners.org. You can see how to get started. And we'll be happy. We've got a lot of staff members who are working and happy to dealing with that for you. I do see, again, this is really weird. I see too that you guys are seeing the spam. I sometimes think I live in a naive world. I guess they're trying to get you to click those links to empty your bank account. So please don't click those links. I'm hoping that Julia and Alex, who are helping, can help maybe ban them from the page. It seems like it's like whack-a-mole. You probably ban one person and somebody else comes back up. But I live in a naive world that it's hard for me to even understand that there's people out there that spend this time doing that. But anyway, they're here. So maybe I'm being too judgmental and they're interested in being therapy animal handlers, but I doubt that's the case. So, all right. So we got through that sort of the first 6 months, focusing on our current teams, talking about and sharing our concerns around the need for new teams and getting new handlers and all into the program. And then I would say that a lot of our regular communications kind of started to be restored. And I think all of you maybe sort of got through those first 6 weeks where everybody was locked down at home, stressed out, zoomed out, everything that we were doing to try to cope. And I felt like communication started to get more restored and more natural between all of our wonderful existing therapy animal handlers and between your staff team. And a couple of the things that came through loud and clear, and I'm seeing it again too in some of the comments today, is how much you miss visiting as a handler and how much your animal misses visiting. And we recognize that it's true. And I will say we knew that was going to be the case on some level, but how profound that missing is, that sense of loss, is what really, really struck me, and for you and for your animals. But you inspired us, and we started to hear from all of you about creative and fun things that you were doing. So many of you have been sending notes and cards and the trading cards to places that you visit. We love seeing everything that you've got going now that you're sharing with us. We love seeing the parades. We know there's window visits. I think some of my favorite are the cutouts. I see that there's a lot of really large size cardboard cutouts of therapy animals greeting people at facilities where they can't visit. I think those cutouts are really fun and really great. But you inspired us in terms of the idea around virtual visiting, and we've established a Facebook page. I hope you know that. In addition to this Facebook page, we have a Facebook page just around therapy animal visits and the virtual visits, and that's all the content that you've been sending us that we've been able to share, right? So many of our handlers, or the facilities can then pull up that Facebook page and share that, and they can share some visits of what you're doing virtually or messages from home with the clients that you normally visit and that you normally all would visit with. So the Facebook page is Therapy Animal Visits with Pet Partners. And if you haven't checked that out, I hope you will check that out soon. So all of this was then happening, right? You all were being very creative, and you were visiting in some way, not the traditional way, but you were finding ways to stay connected and to maintain some of those connections. But for those of you that do know Pet Partners, if you've been with Pet Partners a long time, you do know that we pride ourselves on the fact that we're the serious therapy animal organization. We know we're not the easiest. We do know that there are many folks who would like to pass muster, let's say, with Pet Partners, and unfortunately don't make it for some reason. But we're also the serious organization, and we care about the research. We care very much about the scientific underpinnings, about why, when you take the time to take your companion animal into a nursing home or into a hospital or into a facility, why it actually works. Why we feel not just happier, but also healthier when we have a chance to spend time with these amazing animals, when there's a chance to pet their fur, stroke their fur, pet their coat, and look into their eyes where that oxytocin exchange happens, right? And so that's not happening. That's not happening with a cardboard cutout, or it's not happening maybe with the window visits the same way. And we kind of thought, well, so what does that mean? Like, this is great, right? It's great that we're engaging in the communities. What you're doing is wonderful. But many of you worked with and know on our staff team, Dr. Taylor Chastain. And Taylor, pretty early on, she's a sharp cookie and a hard worker. Oh, somebody just got their cutout delivered. It's coming tomorrow. Send us a picture when you get it. Post it on Facebook for us. But Taylor is a sharp cookie. She is a doctorate of general research psychology with a concentration in animal-assisted interventions. And Taylor pretty quickly realized that there was a sufficient body of research out there that she could pull together through a literature review that talked about not the oxytocin exchange that comes when we spend time with a pet and gaze into their eyes, but what the term she coined is animal-related engagement. And she quickly pulled together the literature review, a white paper on ARE for shorthand. It's available now on our website. Julie will probably share a link here in a moment. And it's been downloaded. It went live as a resource on, I think, April 23rd or 24th. It's been downloaded 500 times. And over 3,000 people have watched Taylor's presentation on animal-related engagement. So it's the science behind, or sort of the impact of, the human-animal bond that comes from just remembering a therapy animal visit, remembering a favorite movie or a book, or something from your childhood, maybe a pet that you had and a fond memory, and that you get those same warm feelings and relationships, memories, have a positive impact on our mental health and well-being. So for Taylor, she talks about it's when, as a child, when she read Where the Red Fern Grows, that great book about the little boy training his coon dogs. I think it's Old Dan and Little Ann. And how many folks grew up developing a love for horses because of Misty of Chincoteague and that incredible, wonderful book by Marguerite Henry. So a lot of neat stuff out there. We just saw Luna and Luna's coloring opportunity there as well. That's another idea of animal-related engagement. So that's pretty exciting content as well that we're pleased about. Just a fun little anecdote. About a month later, Taylor was attending a session from another professional association that had an interest in the human-animal bond, and they didn't know Taylor was a participant. And they were talking about how to respond in this COVID time, and talked about, the presenter spent 30 minutes talking about Pet Partners' white paper on animal-related engagement. So it's gotten a lot of traction pretty quickly. Okay, I'm going to take a moment here and try to take a look. It looks like we seem to we figured out how to get rid of those spammers. So you can see there too. So we put some responses in there. So I see there's a few questions there. Somebody asked about what do we expect from facilities in terms of returning to visits. I'll talk a little bit more about webinars and Facebook Live events that are available. But I want to just say, if we don't get to a specific question that you have, if you have a question specific to joining the therapy animal program, if you're a facility director and you have a question about something very tactical or very specific to visiting, either email us at operations@petpartners.org or use the Contact Us form at the website, and we'll get back to you with any of those very specific tactical questions that you may have that we don't get to. If you pose a question and I just missed it, I apologize because of the spam. Was very distracting. But something for me that I don't get to that you want to know from me, you can reach me through president@petpartners.org, and we'll follow up on that as well. So I do see a lot of interest on the cardboard cutouts, and it looks like Tiger said she just got it from her area local sign company. So that looks like a great resource. I now have an idea. We're going to see a lot of very cardboard cutouts come out. So folks asking about when testing will resume. We did an entire webinar on that last week. It's available on our YouTube channel. And there's a lot of things that go into that. It's a lot around both visiting and evaluations in terms of when people feel comfortable attending, what's going on in your local community, what's happening around, certainly just as a country, as it looks as we are now migrating more to an acceptance and an understanding of wearing masks. Hopefully that will have a positive impact, because we've seen large swaths of the country going in the wrong direction. And we, in the webinar, and I'll summarize, Jesse and Katie communicated to the 400 plus folks who attended, is taking all of those factors into consideration. It's your health, it's your risk, it's your animals' involvement and engagement, it's the client safety, it's what the facility has to say and their risk management, and if they're overwhelmed. But we also, under that banner of we care, we also want to be good citizens and good neighbors, and we don't want to potentially contribute to the spread. So it's not, when we think about it, we think about our own individual response, but we also try to communicate how you're showing up in your community, and things like if you are very careful. You're very limiting your activity. You live alone. You're not an essential worker. Maybe you are retired. And the one activity that you do, wearing a mask and social distancing, with the blessing and the invitation of the facility, as this is the one activity that you do, then maybe you could return to some of your visiting activities sooner. If you're an essential worker, you're out in the public, you're highly engaged with the public, or let's say you do attend a wedding or a gathering of 50 people, then maybe for the next 2 weeks you don't visit. And again, we want you to be a good neighbor and a good citizen, good community member. And then if you were back to visiting, then you limit your visitation as a result of that. So again, so I see people are looking for the email address for me. You can reach me at president@petpartners.org, and maybe we'll get Julia to get that up there again so people can be thoughtful and be, or an email about that, but be thoughtful about your visiting. So I wanted to talk about all of that. So let me talk about that. I mean, I'm going to pull up and look here. I mentioned Facebook Live and I mentioned webinars. So these are available on demand, for lack of a better word, I guess, on our YouTube channel. And we'll get maybe Julia can. I know Julia was having thunderstorms where she works from Winchester. Hopefully she's still with us and didn't get knocked out. But the links on our YouTube channel. So some of the webinars that are available that you may be interested in. We just did that one last week that I told you that Jesse and Katie Loudon did, and that's available. But we did shelter pets as therapy animals, always a popular topic. We've done some specific more to dogs, but many of you know Gina Fisher. She's done some great webinars for us around animal behavior and dog behavior. So we've done some things around keeping your dog engaged during shelter in place, right? Keeping your animals busy and active and mentally engaged while they're not visiting. We've done a dogs love stay-at-home orders, but what comes next? We do have the one that Taylor did about animal-related engagement that's been viewed more than 3,000 times. We've done a crisis response. I'll talk a little bit more about crisis response. Back in the beginning of March, serendipitously, maybe? One of my friends call it serendestiny. We did a Zoonosis 101, how germs spread between animals and people. And that's when people were just starting to talk about this thing called COVID-19 and this novel virus, coronavirus, that we were all hearing about for the first time. But there's some great Facebook Lives there that are archived that you might want to go and take a look at if you haven't. And then on the webinars, we do have another Volunteer with Your Pet webinar coming up. I think it's on July 31st at noon Pacific time, 3 o'clock Eastern time. We've done COVID-19 updates, a webinar for community partners, leaders. So if you missed that, you want to go back and check that out. We've done virtual and other recruitment strategies for our volunteer leaders, community partners. We've done another one. There is a safe return to visiting now or later that we did earlier on. We've done, we have one coming up on August 4th, handling skills for safe visits. So this is kind of a watch your space on Facebook. And then also, I think I've said a lot. I apologize for that. No, you don't realize that you have one of those nervous tics, I guess, until you do a Facebook Live. There we go. Now I'm distracted. We have more coming up that you can also, for those handlers, our existing handlers, watch your emails, open your emails. We have a great open rate. I've joked about this before. We track our open rates on all the emails that we send to you. Mary Margaret has the most open rate, highest open rate, and she loves to hold that over my head. But make sure we have a great open rate, but not everyone always gets around to opening it. So make sure you are opening your emails from Pet Partners, because that's where you're going to find out if you're an existing handler, volunteer, evaluator, or instructor, where you're going to find out about the upcoming webinar. So I see Sue's comment, and I thank you, Sue, for saying that, the comment that you just made, thanking the staff for the increase in communications. And this is really touches me, and I wanted to mention this and say thank you. I haven't had, I don't think, a single interaction with any of you where you haven't taken the time to recognize, acknowledge the increase in communication, the increase in support from your staff team, and to say thank you. And we share those widely amongst the staff, because when we're not at work for Pet Partners, like all of you, we are struggling with this horrible time. So we have staff members who have spouses or partners who have lost their jobs. We have staff members who were suddenly thrust into the role of parent-teacher or teacher for the first time, trying to juggle work. I mean, all the things that you see that's happening, your family, your friends, that's happening here too at Pet Partners with your staff team. So when you take time to say thank you and to recognize everything, then we appreciate that too. It goes a long way with this stuff. I'm sorry, I just got sidetracked. Walter said his his client email server won't let us know when he opens your text. So don't tell Mary Margaret that, Walter, because then she's going to somehow use that to convince me that her open rates are even higher than mine, and I don't need that. Hey, I don't need that aggravation from Mary Margaret. Anyway, all right. So let's go on and talk about some other things then too, about sort of like kind of what's coming and what else is going on. So I mentioned crisis response, and I want to talk about that just for a second, because many of you have taken this downtime to work on getting your animal-assisted crisis response credentialing with Pet Partners. It's a heavy lift. It's a lot of work. Some of you know that the content for the education was created with input from Dr. Leslie Stewart, who is, I don't think I'm exaggerating if I say she may be the leading global expert on trauma and animal-assisted interventions. And over 500 of you have now achieved that credential with Pet Partners. And when we developed our AACR program, we were well aware, we knew there were other programs out there, but we had a very focused, a vision around how we wanted our program to stand up against the others. And it very much goes back to that we care, and especially that we care about the animals. So we know that there are other crisis response programs who, when there's a shooting or there's a crisis in the community, put their therapy animal partners on a plane and fly them across country to do this good work and this service. We don't believe that's in the animal's best interest to get on a plane and then be expected to go do crisis response work. So our program was always intended to be neighbor helping neighbor and within driving distance, in terms of when we ask for a response and we are looking for people to come out in that crisis response role and serve their community, we're looking at a limited drive time in terms of where we would put that request out to you as a registered crisis response handler with Pet Partners. Also, when it's a crisis response, more of like a natural disaster, if it's a flood or a fire or something, we also don't think it's a role of a therapy animal team to come into the community and take up much needed resources like hotel rooms. So again, we believe that after doing crisis response work, your community is best served when you and your therapy animal companion can drive home at night and sleep in your own beds and not take up those resources in the community. So with more than 500 of you with your crisis response credential, thank you. Shout out, congratulations for completing it. And if any of you are interested in getting started with that, now's a great time, because it will take some of your time on the human end of the leash to navigate through and complete all the education. So I want to encourage you to think about that. Want to mention briefly, if you haven't heard about our program, We Are All Ears. So many of you I know, we've got, I can't remember now, I get the Read With Me and Walk With Me initiative numbers. I believe more than 5,000 of you are registered as Read With Me teams with us now. And that's, of course, our initiative where a child, a struggling reader, reads to a therapy animal. For those of you who don't know, who are newer to Pet Partners, great research around the gains in literacy that a struggling reader can make reading to a non-judgmental animal. Some of those gains and some of that research coming out, I see Deb Gibbs was here, the great group at Tufts. Done some of that research. Dr. Nancy G on our Human Animal Bond Advisory Board, they've done some nice research. But a struggling reader can make greater gains in proficiency than traditional reading intervention specialist methods. So that Read With Me initiative is very important. And suddenly, children are at home, they're not in schools, now what? So we pretty quickly pulled together what we are calling We Are All Ears, now brought to you, and you'll hear more about it with our partnership with Elanco. They've gotten behind that, and they're going to help us push that out, especially as we get back to a return to school time frame, which may not be a return to school scenario. But the We Are All Ears website, anybody can go on there and make a pledge to read to their own pet, their own companion animal, if they want to do it based on number of books read, number of hours that they want to read. You can set you as the parent with the child can set the goal that's age appropriate. And there's just great resources on there. There's cutouts, bookmarks, coloring pages. But your child can actually take the pledge to hit a goal and a reading goal. So if you don't know about We Are All Ears, we hope that you'll check that out. And like many resourceful things that companies and people are having to come up with because of the pandemic that are here to stay, we hope and believe We Are All Ears is here to stay. Some of you know that coming up on September 26th is the 3rd annual World's Largest Pet Walk. And we coined that term because this is a pet walk on the same day that can happen anywhere in the world, and it literally does. So last year we had folks in Australia walking and raising money. We've had some of our great teams in Argentina participating, anyone. And fits right in. I'm not claiming that we had any genius foresight or that we in any way had any advanced idea this horrible thing called a pandemic was coming, but you can do it on your own. It's a pledge that you can just make. You can get out, walk with your own pet. You can do it as a social distance walk. Many of you, I know, our community partners and groups are going to do it as sort of the walk and the parade at facilities where they visit. But you could also go on to, and hope you will take a look at the World's Largest Pet Walk website, sign up. There's fun stuff, fun t-shirts, cute bandana for your walking partner, your animal walking partner. We hope you'll sign up, raise money, and participate with us. And let's make September 26th a day where we all get out and we all walk with our pets and do it alone together, or whatever we're going to do together to get through all this crazy time. Let's see how we're doing on time. I don't know how much longer you all want to hear my voice. A couple things I want to mention about just quickly, and then we'll start wrapping up, is when I talked about us being the serious organization, we very much pride ourselves on that. That's important to us, and that we are research driven. So we are continuing our investment in research, and with funding to the Human Animal Bond Research Institute, and have a new project coming up this year where we're going to be looking at the impact of therapy animal visits on children visiting an emergency room. And they're still working through some of that, of course, because of COVID-19. But one of the challenges that we have with getting good quality research in this animal-assisted intervention space is like the control group, right? An experimental group. Those of us who aren't researchers or probably were exposed to that in high school biology. And who doesn't want to be in the group that gets the therapy animal visit? So this research is constructed for the children that don't get the therapy animal visit as part of the control group. They will still get the therapy animal visit before they leave the emergency room. But we're excited to see that project, and there's some other projects that we've been funded that we're anxious to see the results about specifically. The other big thing that I just want to mention, and I do want to confess to, I have not done a good job about following the comments. I just got a little bit off my game with that spam. It was really creepy, and I don't know. So I apologize for that. I'm going to take a real quick look here. Some stuff about crisis response. Oh, I do want to mention something. I think I can do this without getting teary-eyed, and I'll get back on track. But I see Deb Gibbs is here. Maybe I can't. We know that some of you have lost your therapy animal partners during this time, and it's a crappy time to lose your pet. So we know Deb's lost Boo, and others of you have lost. I didn't think I get this weirded out. One of our staff members, lost his dog. It's never a good time. And I always say that if our love were enough to keep these animals alive, they would live forever. But this is a particularly difficult time to lose a pet. So I just wanted to acknowledge that for those of you that have, and say that our hearts are with you. All right, let me get back on track. Okay. The one big thing that's coming, and I'm not prepared to make a formal announcement. We have a lot of work to do, but something will be coming down the road. And that's this idea that pet partners can and should do more to serve professionals. When we talk about all this mental health aspect and the impact, my goodness, a lot of people in their jobs have been horribly impacted because of this. Psychologists, counselors, social workers, especially in terms of their caseload. And I don't think this is going away anytime soon. So we've been talking about this for some time. We've been doing a lot of work. around what do professionals need and want. And this is just kind of just a really interesting side note story I'll tell you. When I first came to Pet Partners and I had a chance to travel, attend an international IOHIO meeting, International Association of Human-Animal Interaction Organizations, I noticed that outside of the U.S., this field of animal assisted interventions grew up, if you will, as very much a professional endeavor. When you get outside of the U.S., there's not a lot of volunteer programs like ours, but there's a lot of professionals practicing with their animals, and there's some countries where there's even a paid job. I kind of think of it along the lines of like a teacher's aide role, where people with their pet have employment as a result of it. Here in the U.S., it's grown up as very much a volunteer endeavor. Now, a little bit maybe because of the nature of volunteerism. So there's this really cool study, some of you just may be curious or interested in this. The charity, I think it's a Charity Aid Foundation, it's been a while since I looked at it, publishes this, they call it the, I think it's the Global Giving Index, World Giving Index every year. And they rank about 146 countries on three things. One, the donations, how charitable they are, likelihood to make a donation, how likely people are to volunteer their time to an organization, and then third, the Good Samaritan, how likely are people to stop and help a stranger. So I'm not going to say that volunteerism is strictly an American activity. That's not true. But and I'm not sure what the algorithm is that puts weight on those three categories. But certainly here in the U.S., volunteerism is, we love it, right? It's something we do, and people do generously with their time. And outside of the U.S., there's a lot of countries where that just isn't in their fiber and in their culture, but whereas they may be much more likely to stop and help a stranger. But I do believe that therapy animal visitation and AAI has grown up more in the U.S. as a volunteer activity because of our passion and the love that we have for volunteerism. But increasingly, we see professionals who want to take involve their pet in their practice. And some people do their homework, very knowledgeable, know about animal welfare component, know about good handling skills, know everything they need to know. But we hear from a lot of well-intended professionals who just have a nice dog and they want to start taking it to work. And I liken this to the fact, maybe some of you have heard about play therapy. So nobody, as a counselor or a psychologist or something says, well, I'm a counselor and hey, as a kid, I like to play, so I'm just going to start doing play therapy. No, there's like people know they need education, there's certification, there's a lot that goes into being a play therapist. And yet here in this space that we're in, there are some well-intended folks who just say, well, I'm just going to start bringing my dog to work. What's the harm? Well, there is a lot of harm and a lot around the animal's welfare. And those of you that know animal behavior and have been through the Pet Partner course and know we limited our time visits to 2 hours, there's a reason for that, right? Our pets don't wake up at 6 a.m, turn on their cognitive abilities, raring to go, and then crash into bed at 10 o'clock at night. They have a whole different thing going on there in terms of how much interaction is too much before they're conked out on your back seat on the way home from a visit where they've been mentally exhausted. So we're doing a lot of work in terms of understanding what it is that professionals need and want. And we look forward to stepping into that space in a very meaningful but reputable way going forward. So more to come about that. Take a quick look here and see if there's anything else. Jackie MD loves visiting in mental health. We know, we love you, Jackie. So many good names here, Catherine, all these folks. Thank you. Thank you guys for all this that you're sharing. So two very quick things, want to wrap up. If you haven't been to the pop-up shop yet, the pop-up shop is still available through August 9th. It's crooked, I can't say, it's backwards. We have your Pet Partners mask available. There's other fun stuff that are available on the pop-up shop. You can find that through the website, or maybe Julia will get that up here in a minute. For those of you who are new to Pet Partners, you're not a registered handler, if you want to sign up and get our e-news, some of you as handlers may not be getting that as well because of the way you manage your preferences. But every other Wednesday, we send out an e-news. It goes out to about 120,000 people. But we include great stories in there that you feed us, that we pick up from our electronic clipping service when you're in the news. We talk about things that Pet Partners has coming, new releases. Try to think what else goes in there. I mean, we've got information in there about, we just recently put in there about estate planning. If any of you are doing, that's kind of a gruesome thing to talk about in a pandemic, I guess. But it's always good to have an updated will. We have kits available and information that you can request from Pet Partners if you want to know more about that. So there's just always interesting things that are going out in e-news. And if you're not getting it, we hope that you will get it. So, all right. I see that the pop-up shop is there. I see the subscribe, the email. Thank you, Julia. She has been Julia on the spot with all of that. Let's see what else. Anything else here? I can see real quick. I don't think so. I think we're, 45 minutes in. Again, I'm sorry that I didn't do a better job of watching the comments. I'm usually a pretty good multitasker, but this was my first Facebook Live event. So I hope that if I get invited back, I'll do a better job next time. But again, please, want to wrap back up again. If something we didn't answer and you want to know about, you can reach me at president@petpartners.org. Reach your therapy animal team staff at operations@petpartners.org, or always using the contact us form on the website, and we'll make sure that your question gets to the right person. So thank you. I'm going to go give Gidget a hug and look into her eyes and be grateful that I've got my pet with me through this time. And all of you, please stay safe, be good neighbors, be good citizens. And like you, we look forward to when you can return to visiting. So thanks all. Have a good evening.